Still breaking out even though you wash twice a day? The secret to clear skin isn't harsher scrubs, it's sequence, dosing, and barrier care. Today, I'm revealing my deep cleansing SE Core ETS that flatten pimples and keep new ones from forming. Start with an oil cleanse, 60 seconds on dry skin, nose creases, sides, tip, chin. Emulsify until milky, then rinse. Follow with a water cleanse for 60 seconds using a salicylic or heartleaf Chach green tea cleanser to sweep inside pores without stripping. If your skin feels tight or squeaky after rinsing, that's barrier stress. Switch to a gentler gel. Blackhead zones, nose, sides, chin. BHA 0.5, 1%, 2-4x week PM. Press don't rub. Oil soluble, dissolves plugs. Sensitive cheeks, jaw. PHA, LHA. Or gentle lactic, 1 to 3x week for a low sting polish. Skip acids on retinoid nights. No gritty scrubs. Micro tears, Hans more clogs later. Once weekly, 8 to 10 minutes. Kaolin or bentonite clay with a pinch of papaya or pineapple enzyme and green tea. Rinse when the mask is about 80% dry, before it starts cracking, to avoid dehydration and rebound oil. Now for an optional step, and we must stress, extraction. This should only be attempted on blemishes that are truly ready, meaning they have a visible, firm whitehead at the very surface of the skin. Never force anything that's deep, red, or painful. Your first priority is hygiene. To prevent introducing new bacteria into an open pore, which can cause infection and worsen inflammation, you must create a sterile environment. If you're using a comedone extractor, thoroughly sanitize it with at least 70% isopropyl alcohol. If using your fingers, never use your bare nails. Instead, wrap your index fingers with fresh tissue to create a sterile, non-slip barrier. The goal is to coax the blockage out, not force it. Position the loop of your tool or your tissue-wrapped fingers on either side of the blemish. Instead of pressing straight down, which can push the impaction deeper, hold the tool at a slight angle. Apply slow, steady, and gentle pressure downwards and inwards. Imagine you are trying to lift the contents up and out from underneath. A slight rocking motion can help ease the contents from the pore wall. The entire process should be delicate and controlled. Adhere strictly to the rule of twos. If the contents do not emerge after 2 gentle attempts, it is not ready. Stop immediately. Forcing it will only lead to trauma, causing microtears in the skin, increasing the risk of scarring, and triggering post-inflammatory hyperpigmentation, those stubborn dark spots that can linger for months. And to be perfectly clear, this technique is never for deep, painful cysts or nodules. These are inflammatory lesions that must be treated by a professional. Attempting to pop them will only worsen the inflammation and can lead to significant scarring. Immediately after a successful extraction, it's crucial to soothe and protect the area. Gently dab a targeted spot treatment containing an anti-inflammatory and antibacterial ingredient like salicylic acid or benzoyl peroxide directly onto the pore. This helps to clear out any remaining debris and prevent new bacteria from entering. Follow this by applying a cold compress or an ice roller over the area for 30 to 45 seconds. The cold helps to reduce redness, minimize swelling, and calm the skin, promoting a faster, cleaner healing process. Now we move to the crucial treat and seal phase. After extractions, your skin is prepped, but also needs to be calmed. First, we soothe. Immediately after cleansing, your skin craves hydration. Reach for a gentle, alcohol-free toner or essence. Look for hero ingredients like Centella asiatica, also known as Cica, which is fantastic for healing and reducing inflammation. Heartleaf is another excellent choice for its soothing properties, while panthenol helps repair the skin's barrier. Mist it generously or gently pat it in, letting it absorb fully. Next, we correct with a targeted treatment. The key here is to choose just one active serum to focus on per routine to avoid irritation. For those dealing with excess oil or congested pores, a niacinamide serum at a concentration of 4 to 5% is your best friend. It's a powerhouse for regulating sebum production, minimizing the appearance of pores, and strengthening your skin barrier without being overly harsh. If your primary concern is post-acne red marks, lingering sensitivity, or uneven skin tone, opt for azelaic acid instead. This gentle acid works wonders to calm inflammation, reduce redness, and gently exfoliate the skin's surface, promoting a more even and radiant complexion over time. Apply a thin, even layer to the affected areas or your entire face. For active, inflamed whiteheads that need immediate attention, a spot treatment is the safest approach. Use a clean cotton swab to apply a small amount of benzoyl peroxide at a 2.5% concentration directly onto the blemish. If your skin is sensitive to BP, a sulfur-based spot treatment is an effective alternative that helps to dry out the pimple and reduce inflammation. Finally, we protect and seal. Lock in your treatment and provide lasting hydration with a lightweight, non-comedogenic gel moisturizer. Look for formulas containing hyaluronic acid for hydration and ceramides to reinforce your skin barrier. During the daytime, this final step is non-negotiable. Always finish with a broad-spectrum sunscreen of at least SPF 30 to protect your skin from UV damage, which can worsen acne and hyperpigmentation. The final step is sustain, solidifying your gains through smart routines. The key is skin cycling, a strategic rotation that prevents breakouts without overwhelming your skin. Think of it as a workout plan for your face. On night A, we exfoliate. After cleansing, apply a BHA product like salicylic acid to dissolve oil in your pores. Follow with a soothing serum and a lightweight gel moisturizer. Night B is for treatment, featuring a retinoid. Use only a pea-sized amount for your entire face to avoid irritation. Follow with a hydrating product and your moisturizer to buffer its intensity. Night C is for recovery. No strong actives. Focus on gentle hydration and barrier support with ingredients like ceramides or hyaluronic acid. This cycle of exfoliate, treat, recover is the foundation for long-term clarity. A critical rule: never stack your potent actives. Your retinoid, strong acids like AHA, BHA, and benzoyl peroxide should never be used on the same night. Combining them is a fast track to an irritated skin barrier, which will only cause more inflammation. Beyond products, small daily habits have a massive impact. First, change your pillowcase 2 to 3 times a week. Second, wipe your phone down daily. And third, cleanse your face within 15 minutes after a workout to wash away sweat and bacteria. Finally, a few more game changers. Clean your makeup brushes weekly. Avoid heavy creams on your T-zone if you're oily. And most importantly, hands off your face. If a whitehead has surfaced, don't pop it. Instead, apply a hydrocolloid patch. It gently draws out fluid, protects the spot, and speeds up healing, dramatically reducing the risk of scarring. Drop a if you're starting tonight. Comment your skin type plus toughest zone, nose, chin, jaw, and I'll pin a personalized mini-map. Like, share, and subscribe for barrier-safe deep cleansing that actually works.